Who, what, where, why, and how? The answers are inside health. Coming up, a British hospice, St Christopher's in London, has been awarded one of the most prestigious humanitarian prizes in the world. The award for making extraordinary contributions to alleviating human suffering. With AIDS reaching epidemic proportions in Africa, efforts are being made in Asia to try to prevent a similar disaster from occurring. In Vietnam, barbers and shoe shiners are employed to spread the message in order to halt the spread of the deadly disease. Thousands of Afghanis continue to fall victim to landmines planted during previous wars. Afghanistan is the world's most heavily mined country, and doctors struggle to treat the consequences of the landmines' devastating impact. And more doctors are turning to Chinese medicine to treat their patients than ever before. The School of Medicine at Beijing University is now collaborating with several leading medical institutions to teach acupuncture to Western-trained doctors. But first, to Pine Ridge Reservation, South Dakota, where Native Americans are dancing to celebrate the success of their children who've graduated from university. But behind the festivities, a health crisis threatens the future of the Oglala Sioux people. More than half of American Indians over age 45 are diabetic, and diabetes rates are 8 times higher than in the general population. These facts may be startling to us, but they're a stark reality for diabetic sufferer Paul Rooks. Paul first began noticing small black ulcers on his feet a year ago, and in that time he's lost both legs just below the knee, along with 8 fingers. To make matters worse, Rooks must undergo dialysis because of kidney failure, not an easy task with vast distances to cover. 3 times a week he travels over 100 miles to receive his life-saving blood treatment. It takes 4 hours to clean his blood, and afterwards he often feels exhausted. Shannon County, which spans Pine Ridge, is the poorest county in the United States, but poverty is just one of the factors contributing to the burgeoning diabetes rates. In the days of feast or famine, the physically active Native Americans could consume large quantities of food in a sitting, and their efficient bodies stored it for the lean times. But now, the reservation lifestyle, combined with a consistent supply of food that's high in sugar, has turned a positive into a deadly negative. While family members now keep the reservation's former chief of police going, he devotes his time to stopping the diabetes epidemic from destroying his people. One of the most alarming aspects of this national tragedy is that the disease is a legacy that's being passed on to the younger generation of Oglala Sioux. 50% of the reservation's population is under 18, and they're becoming diabetic earlier and earlier. Just a few weeks ago, a doctor on the reservation diagnosed an 11-year-old with adult-onset diabetes. Lack of physical activity is contributing to the problem. Playgrounds are empty, and fields are vacant because physical education is no longer taught in the schools. That's a message Susanna Killsback, a diabetic herself, heard loud and clear when her children were diagnosed with a condition called acanthosis nigricans, or AN, a warning sign for diabetes risk. AN appears as a darker layered region on the back of the neck. After improving their diets and encouraging them to exercise, the AN has disappeared on her son and diminished on her daughter. Susanna shares her success with other parents in the hopes of keeping future generations diabetes-free. Within the wider community, 16 million Americans live with diabetes. Proper management of glucose and insulin levels is critical, especially for those requiring insulin injections to regulate blood sugar levels. For those patients, the disease can be especially difficult to manage. Pulmonary delivery via inhaler devices has been in development for several years now by drug companies. The inhalers are electronic, easy to use, and said to be just as effective as injections. The patient simply takes the required dosage form and inserts it into the device, then closes the top of the unit and inhales the insulin rather than injecting it. Nasal and oral insulin delivery methods are also in development. One company, Ontaries, offers a less painful pen injection. So diabetics can finally look forward to less of a pinch when it comes to managing their disease. The US Department of Health and Human Services has confirmed that one of the deadliest and most costly diseases, type 2 diabetes, is preventable with a regulated regimen of diet and exercise. A major clinical trial compared diet and exercise treatment with the drug metformin in 3,234 overweight people. Principal investigator Dr. Robert Ratner found that metformin reduced type 2 diabetes by 31%, while diet and exercise achieved a 58% success rate. Type 2 diabetes accounts for 95% of all cases in the US, with 800,000 new cases reported annually. The trial ended a year ahead of schedule because the data clearly demonstrated that diet and exercise were effective in preventing the condition. Around 150 beds are being kept empty in the already crowded Khyber Teaching Hospital in Peshawar for a possible emergency influx in the case of further attacks in Afghanistan, while more and more Afghan refugees come to the hospital for medical help, mostly for their children. The Afghans receive free medical care at the hospital, but most of them haven't improved. 11-year-old Khatun lies listlessly on a hospital bed, dreaming of returning to her mother. Smuggled over the border from Afghanistan before the restrictions were imposed, she's been weakened by weeks of illness. Her kidneys are failing and her chances of survival are slim at best. In the 52-bed child nutrition unit lies 2-year-old Gulbaz, suffering from severe malnutrition. His father, Mohammed Kabir, said their village was destroyed in fighting in the early 1990s. The family first fled to Pakistan 10 months ago, returned to Afghanistan, and then made the journey once more in August. The UN has warned of a catastrophe of stunning proportions in Afghanistan as millions of people face starvation, lack of shelter, and the onset of a harsh winter. At 83, Dame Cicely Saunders continues to dedicate her life to improving care for the dying. Now, St Christopher's, the hospice she founded in 1967, has been awarded the Conrad N. Hilton Humanitarian Prize of $1 million. St Christopher's Hospice is the world's first teaching hospice, pioneering new approaches from Dame Cicely's early work in controlling pain and treating the psychological, social and spiritual needs of each individual patient. St Christopher's cares for more than 1,600 patients a year free of charge, as well as for patients who choose to stay at home. Still in England, the Liverpool School of Tropical Medicine has received a grant in recognition of its efforts to eliminate filariasis, one of the world's leading causes of disability. The disease is prevalent in 80 countries, with 1 billion people at risk. And while manufacturers generously donate all the drugs needed, the grant will boost other crucial areas of disease control. The school's main priority lies in analysing the distribution of filariasis to define the areas where the drugs will be most effective in halting the transmission of one of the most disabling diseases the world has ever known. The latest figures released by UN AIDS indicate there are about 7 million people living with HIV/AIDS in Asia. In Thailand, hospitals that cater for AIDS patients are overflowing, like one in the northern province of Chiang Mai, which cares for those suffering the final stages of the deadly disease. Many are abandoned by relatives who can't handle the social shame of caring for someone with the disease. If that isn't bad enough, most can't even afford the drugs now available that can ward off the onset of full-blown AIDS. Instead, they rely on ineffective traditional medicine or antibiotics to treat the opportunistic infections like tuberculosis caused by AIDS. The spread of HIV in Thailand has been slowed according to experts, but more needs to be done to bring it down to manageable levels. This is Myanmar, and the AIDS situation is equally grim, although access to statistics in this impoverished military dictatorship are hard to come by. Some medical experts predict that Myanmar is facing an epidemic that could soon rival parts of Africa, with more than 500,000 people believed to be HIV positive. However, Myanmar's military leaders continue to deny there's even an AIDS problem. As a result, medical treatment and support for sufferers is hopelessly inadequate. According to visiting American AIDS experts, strategies must be devised and quickly put into practice if the country is to have any chance of curbing the spread of the killer virus. And when it comes to spreading the word about AIDS, the authorities in Vietnam have come up with an unusual and effective method, helped along by an army of barbers who work outdoors all over the country. A group of street barbers in Haiphong, 100 kilometers east of Hanoi, have gone well beyond the call of duty to become fully qualified AIDS educators who can tell you about condoms, the dangers of sharing needles, and exactly how people contract HIV. Each barber even has their own selection of AIDS education booklets for their customers to read while they're getting their hair cut. The barbers were trained by an American organization called Family Health International, or FHI, which works closely with the government of Vietnam in preventing the spread of AIDS. There are now 50 barbers involved with the FHI program, and so far they've found that most of their customers feel comfortable enough to read the information and ask important questions. Although the topic of conversation is serious, the barbers try to keep things informal with their customers. For this reason, many of the men come back. They even have their favorite AIDS educator barbers. While the barbers clip away, their customers stare at stickers with slogans like, "Using clean needles is the best way to stop AIDS." Over the past 6 months, a team of 20 shoeshine boys were given the same training course as the barbers, and just like the barbers, they now share their knowledge of AIDS prevention with interested clients. So far, around 38,000 customers have been reached, and about 19,000 men have taken home AIDS booklets and information sheets. Family Health International is hoping to increase the numbers of AIDS educators working in Vietnam and is urging other organizations to adopt similar approaches to prevent AIDS reaching epidemic proportions in Asia. For northern Afghanistan's landmine victims, the Red Cross station is a place for hope and a new life. Those wounded are collected at various first aid stations and brought in bleeding and in shock. As many as 10 people die here each day. There are more victims, but no one hears about their cases because they die unseen, according to health officials. The United Nations estimates that this rugged land is littered with between 5 and 10 million unexploded landmines. Thousands of acres of farmland and entire neighborhoods of some cities are completely off limits. Red Cross worker Abdul Jalal, himself a victim of the landmines, fits new patients with prostheses while balancing on his own artificial limb. This modern horror isn't only deadly for Afghans. The fate suffered by this man could befall any US soldier, Northern Alliance fighter or UN peacekeeper who sets foot in Afghanistan. For now, the victims are Afghans of all ages. Many are children, often struck by mines planted years before they were even born. For them, mines are a part of childhood and a wound they will carry with them throughout their lives. Kate Rowland, head of the Italian charity Emergency, sits with two of her patients, young mine victims, and these are the lucky ones, an injured hand and the loss of only one limb. Sadly, each young victim becomes a strain on families already brought to the brink of famine by the worst drought in memory. Only recently, this man lost both legs on a landmine in Bagram. The culprit was an old Russian-made mine, a remnant of the Russian occupation. But amid this desolation, the health workers see positive results. For every day, they're able to take bed-bound victims and give them new feet to walk out on. A similar danger can be found on the popular beaches of the world. No, not landmines, but thousands of syringes thrown away by drug addicts. The chance of infection from needle sticks is 1 in 30,000, but waiting for blood test results is traumatic. That can be eliminated by the Sterafit. It's a needle and syringe unit developed by Sydney company Harm Reduction Services. A lockable tube secures the used needle, which is then bent beyond reuse inside. According to experts at the University of Sydney's Department of Public Health, the device is a breakthrough in preventing injuries and infections such as HIV or hepatitis. Australia has a system of needle distribution to drug users. 30 million are handed out each year by government-backed agencies. Tens of thousands of them, however, end up in public places such as beaches. Sterafit's introduction should now make the sand safer, and its inventor is hoping to market the device worldwide. And speaking of environmental hazards, high levels of the air pollutant ozone and soaring temperatures can make breathing difficult, especially for asthmatics and others who suffer from respiratory problems. Industrial and car pollution are key factors in creating dangerous ozone levels. Asthma already causes constriction of the airways, and ozone only makes the tightening worse. In a recent survey by the American Lung Association, fewer than 50% of asthmatics knew that air pollution could bring on an attack of breathlessness. Each year, asthma attacks kill 5,000 people in the United States alone. Even those who don't suffer from asthma can have breathing problems on heavy ozone days. Everyone, especially children and the elderly, are encouraged to heed the warnings and avoid strenuous outdoor activities. The Acumedic Centre in North London is set to expand. Its director, Professor Manfong Mei, plans to build an educational, retail and medical centre here, a European mecca for the teaching and practice of Chinese medicine. Professor May's postgraduate courses are becoming more and more popular with UK doctors, reflecting a dramatic change in the way Chinese medicine is viewed here. May's course is approved by both the Chinese Ministry of Health and UK education authorities. Students, like Italian-born Dr. Federica Berklin, believe that Chinese diagnosis and treatment methods are particularly effective for dealing with chronic conditions such as eczema. Professor May is keen to promote the idea that Western and Chinese medicine can complement one another. He's hoping that the 1,000 UK doctors already practicing some form of acupuncture will spread the word to their colleagues who are still apprehensive. The Hummel Clinic in Hamburg is claiming high success rates in using the ancient practice to treat alcoholics. A 45-year-old teacher who chose not to be named has been a heavy drinker for 20 years. She turned to acupuncture because she didn't want to enter an inpatient rehab centre. She says she gave up alcohol after her first treatment. Acupuncture is the stimulation of special points on the body, usually by the insertion of fine needles. It originated in Asia more than 2,000 years ago. It's used to treat a variety of ailments and diseases and is now practiced throughout the world. In an informal study at the clinic of 230 patients, 1/3 stopped drinking. While acupuncture has helped many at the Hummel Clinic, addiction experts generally recommend total abstinence and a 12-step program as the best way to beat the disease. Helen Stevenson has been mixing herbs for just 3 years, but it's a craft that goes back centuries. Her Sydney clinic is still more evidence of the growth and popularity of alternative treatments. More than 60% of Australians now use some form of complementary medicines for conditions ranging from fatigue to asthma. The country's College of General Practitioners has even decided to award professional training credits for doctors who attend clinically based courses in herbalism. The question is, can Western and traditional medical practices happily coexist? A doctor dealing with medical crisis, the naturopath providing support the rest of the time. The Australian moves to integrate herbalism into healthcare is driven by a desire to make sure that different medical traditions remain complementary, not competitive. But in California, one company has taken the competition to the streets in an attempt to convert the city's dedicated coffee drinkers to green tea, a 2,000-year-old Asian tradition. On its first day of business, passers-by were keen to try the frothy green herbal brew. The cafe is the brainchild of Hiroshi Maeda, who hopes to tap into the $18 billion a year coffee market, offering a greener and healthier alternative. Now Maeda has science behind him in his claim that drinking green tea is beneficial. A study conducted by the University of California in Los Angeles found that those who drank green tea regularly had a 48% reduction in stomach cancer and a 51% reduction in chronic gastritis. Great news for Maeda and his customers. That brings us to the end of this edition. We look forward to your company next time.